Pink bismuth suspension, final dose form, is used to treat occasional upset stomach, heartburn, and nausea. It can also help with diarrhea and prevent traveler's diarrhea by slowing the growth of bacteria that may be causing it. However, if you have a fever or see blood or mucus in your stools, do not use this product to self-treat diarrhea. These could be signs of a serious health condition, and you should consult your doctor for proper evaluation and treatment. This medication is also used, under a doctor's direction, along with other medication to treat stomach ulcers caused by a certain bacteria. Do not use this medication to self-treat ulcers. It's important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients. Taking the wrong product could harm you. Always follow your doctor's instructions and guidance when using this medication. When taking pink bismuth suspension, it's important to follow the dosage instructions carefully. The dosage is based on your age, medical condition, and how you respond to the treatment. Do not increase your dose or take this drug more often than directed. If you are using the chewable tablets, chew each tablet well and swallow. If you are using the liquid form, shake the bottle well before each dose and measure the dose carefully using a special measuring device. It's important to take this medication regularly at the same time each day if your doctor has directed you to do so, in order to get the most benefit from it. It's important to talk to your doctor or pharmacist about any other medications you are taking, as this medication may react with other medications and prevent them from being fully absorbed by your body. If your condition lasts or gets worse, be sure to tell your doctor, and if you are taking this medication for diarrhea, tell your doctor if your diarrhea lasts more than 2 days. Side effects from pink bismuth suspension are rare, but the most common ones are darkening of the stools and/or tongue. These effects are harmless and will go away when you stop taking the medication. If you experience vomiting or diarrhea that doesn't stop, it could lead to dehydration, so make sure to contact your doctor if you notice any symptoms of dehydration. Serious side effects are rare, but if you experience ringing in the ears, hearing loss, or signs of serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice anything else, contact your doctor. Before taking pink bismuth suspension, make sure to let your doctor or pharmacist know if you have any allergies, especially to aspirin, salicylates, or NSAIDs. Also, inform them about any medical history you may have, such as bleeding problems or gout. This medication may contain aspartame, so if you have phenylketonuria or need to restrict your intake of aspartame, talk to your doctor or pharmacist before using this medication. Additionally, be sure to inform your doctors or dentist about all the products you use before having surgery. If you are pregnant or plan to become pregnant, discuss the risks and benefits of using this medication with your doctor, as it may harm an unborn baby. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. Do not use this medication after 30 weeks of pregnancy. If you are breastfeeding, consult your doctor before using this medication, as it is unknown if it passes into breast milk. It's important to be aware of potential drug interactions with pink bismuth suspension. Some medications, such as valproic acid and corticosteroids, may interact with pink bismuth suspension and increase the risk of bleeding when taken together with other drugs that also may cause bleeding. It's crucial to consult with your doctor or pharmacist before starting, stopping, or changing the dosage of any medicines. Additionally, be sure to check all prescription and non-prescription medicine labels carefully, and inform lab personnel and doctors if you are using pink bismuth suspension, as it may interfere with certain medical tests. If someone has taken too much pink bismuth suspension and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include ringing in the ears and hearing loss. Always seek medical help if you suspect an overdose. If your doctor prescribes pink bismuth suspension for you, it's important not to share it with others. If you're taking this medication for diarrhea, make sure to drink plenty of water to reduce the risk of dehydration. It's best to consult your doctor or pharmacist for more details on the benefits, daily dosage, and the optimal timing for taking this medication. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, skip the missed dose and take the next one at the usual time. Do not take a double dose to make up for the missed one. Remember to take the medication as directed by your healthcare provider. When using pink bismuth suspension, be sure to store it at room temperature and away from light and moisture. Avoid freezing and do not store it in the bathroom. Keep all medications out of reach of children and pets. Remember not to flush this medication down the toilet or pour it into a drain, unless specifically instructed to do so. Properly discard the product and it is expired or no longer needed. If you have any questions about how to dispose of pink bismuth suspension, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.